All right, well, having difficulty getting pregnant, if so, you are far from alone. 1 in 8 couples in America struggles with infertility. Joining us with some expert advice on improving your chances of conceiving a child is Dr. Christopher Sipe, president of Fertility Centers of Illinois. Thanks for coming in today. I appreciate it.
Thank you very much, Scott.
Okay, let's talk about the fertility window and why is that so important for couples looking to conceive?
Yeah, so if you've got an egg that gets released, it has around 24 to 48 hours to become fertilized.
Okay.
And when you look at women's ovulation, that predicts when the egg is released. So a lot of couples are trying to figure out exactly what day that is. So there is a finite amount of time when they can actually conceive.
Are you finding, with the wonders of modern medicine that as far as getting pregnant through natural means, are the numbers staying the same? Are they getting, is it becoming more challenging? Is it getting easier? Where are we at?
Yeah, if you look at pregnancy rates from the 1700s to now, they're much, much lower now.
Okay.
Lots of potential reasons for that. One of them is we're delaying our childbearing years until we get much older. We're now having contraception, so we're able to not get unintended pregnancies. And so there's a lot of things in our environment, too, that are different from back in the 1700s. So we see infertility on a dramatic rise.
So that said, are we talking about more women starting to try in their, late 20s, early 30s, or even beyond that?
No, there's no good statistics on who exactly is trying to get pregnant when.
Okay.
But when you look at the challenges that couples face, we're seeing a much higher, even over the last 30 years that Fertility Centers of Illinois has been here, a much higher age group than we did in the past. Over the last 7 to 8 years, we've seen the 2-year increase in the average patient age that we've seen.
Okay, so I think, as I mentioned off the top, 1 in 8 couples having difficulty, and I think, doctor, that all of us know someone or know someone who sought out expert help through a fertility clinic and had great success.
Yep.
So what is that magic elixir? What is the secret to getting pregnant through aid by physicians or modern medicine, what have you?
The magic elixir is sex. That would be the best way to get pregnant. But unfortunately, we're here when sex fails.
Okay.
Every couple will have a different reason behind why they're not conceiving. You could have a man who doesn't make enough sperm. You can have a woman who doesn't ovulate. You can have a woman who's older and doesn't have good quality eggs. You can have a woman whose tubes are blocked. So when we meet these patients, we have to evaluate them and figure out what the cause is, and then we target treatment to help that.
Generally speaking, how long have they been trying before they seek you out?
That's a great question. So for women under age 35, we usually recommend waiting 1 year.
Okay.
Typical pregnancy rates per month are around 25 to 30%, up until you've been trying for about a year, and then 85% of people have conceived.
Okay.
That remaining 15% or 1 in 8 is the people that come to see us.
Okay, so of the 1 in 8, give me some numbers as far as their success rate after beginning fertility treatments.
Yeah, so that's a little bit challenging to tell you, because if you've got a 44-year-old, she's going to have a much lower pregnancy rate than a 24-year-old. So in general, if you're looking at a woman under the age of 35 who elects to do something like in vitro or test tube babies, it's usually around a 55 to 60% pregnancy rate.
Now, you brought me to my next question. If we're talking about something like in vitro, is this something that insurance covers? Is this something, and that's good news, right?
Yes. Yeah. So one of the best things about being in the state of Illinois is that actually insurance usually covers infertility treatments. So we're one of the few states in the country where it is covered, and so a lot of people who have an employer based out of Illinois will have infertility coverage.
Meanwhile, there's some pretty serious side effects for those who are struggling to conceive. They may not even be aware of it. Things like anxiety, depression. Talk to me a little about that.
Yeah, so infertility, when you're trying to get pregnant, you're used to just having intercourse and boom, pregnant. But after you keep testing negative on those pregnancy tests over and over and over again, these couples start feeling anxious, depressed. That can start to lead to all sorts of other medical issues. They can start to overeat. They can start to have some high blood pressure. And those by themselves will now exacerbate the infertility problem.
So this is National Infertility Week. Give me your best advice for couples who have been struggling to conceive. What's their first step?
Now, first step is really to figure out, can you conceive? At Fertility Centers of Illinois this week and next week, we're offering free fertility awareness checkups. We're offering women to get an ultrasound and a blood test to sort of judge how many eggs they may have. We're also offering men to do a semen analysis, count how much sperm they have, do they swim, do they look normal.
That's correct. Where can we get more information?
At our website, fcionline.com.
Great, Dr. Christopher Sipe. Appreciate it. Thanks
very much.
Thanks
Scott.
so much.